but why would we want to go to a more sophisticated measurement system?
Yeah.
What would be an example where it's not cutting it just to say, look, you're going to do the same thing. You see the fifth med is plantar flexed, the foot's in a verum position, and you just got to do an offload the fifth med. Why do you need a $7,000 unit?
Sure.
And that's a very simplistic type of approach. However, there might be some more nuanced clinical questions to answer.
Absolutely, and one of the things is people normally ask me, oh, we gait analysis. The first thing to do in gait analysis is see someone walk. My eyes is my best judge, and I can see my patient walk, and I can judge whether they've improved or not improved. Yes, you could, but the main thing is about using the technology to do repeatable measurements. So your patient walks in, you do some clinical assessment, you make notes, but can you communicate that notes, which is in your brain, because it's in your eyes, you know what that patient looks like, and you know what that patient has. It's about you communicating it to your colleague who might end up seeing the same patient in a few weeks' time because you might be on a holiday. If that's the case, it is about objectivizing the data. So if you could support your clinical decision based on the data, then it becomes easier. That's where you need technology. So when I talk about technology in terms of gait analysis, it's not about complicated optoelectronic systems or complicated camera-based systems. It is about you could use a pressure walkway. It is about the type of patient. It is about what outcome measures you want to use. As long as you have data which can support your clinical decision, and many times it is about that technology that you use. If you use appropriate technology, and if you could make appropriate measurements, and this is where we talked about last time, it is when we use the technology, it's appropriate use of technology too.